Misty the president and founder of Medical Patient Modesty, a non-profit organization that works to educate patients and their families about how to have maximum modesty for procedures and how to stand up for their rights to a same-gender team for intimate procedures, and how to prevent sexual abuse by medical professionals. We also educate medical professionals about how to be more sensitive to patients' modesty. I also developed the website for Medical Patients Modesty, and I maintain the website. Our website is www.patientmodesty.org. As you all can see, I am deaf, but it does not hinder me from being successful. In fact, I feel like my deafness has helped me because my other senses, like seeing and observing, are stronger. I often can see and observe things that other people may not see. And it has helped me greatly in running Medical Patient Modesty. I am so thankful to God for blessing me with great parents who learned how to sign as soon as they learned that I was deaf at the age of 22 months old. My mom read a lot to me as a toddler. Many deaf children do not have family members who can communicate well with them, and they do not really gain language skills until they are older, which is the reason many deaf people have a hard time with writing English. I communicate primarily through writing with most people face to face.
The way my grandmother took care of my great-grandmother, who had Alzheimer's disease, opened my eyes to modesty in medical settings when I was only 6 years old, and played a part in why I started Medical Patient Modesty. My great-grandmother was completely bedridden, and she could not talk at all. She required assistance with bathing, dressing, and wore adult diapers. My grandmother let me in the room any time when she changed her mom's diapers and bathed her because I was a girl, but she often said that we had to close the door to make sure that my dad or grandfather did not accidentally see her naked. My grandmother hired female caregivers to assist with personal care of her mom while she worked. I was amazed by how my grandfather respected his mother-in-law's dignity by not seeing her naked. That had a big impact on me. My great-grandmother's mind was completely gone, and many people would argue that it did not really matter about her modesty because she would not know. This reminds me of the argument that medical professionals often use about surgery patients under anesthesia or patients who have dementia by saying that their modesty does not matter since they would not know who all saw their private parts or how they were exposed. Patients should be treated with dignity, no matter what their mental condition is. Medicine has become more gender neutral over the past 10 years. It was unthinkable for a male CNA or nurse to give a woman a bath 30 years ago. It has become more common for males to do intimate care of women today, which has increased sexual abuse cases in nursing homes and hospitals. The medical industry tries to push us to accept that the gender of a medical professional does not matter for intimate medical procedures and that we should just focus on how professional and skilled they are. I wanted to encourage everyone to watch the video, Problems with Medicine Being Gender Neutral, that addresses this issue on www.youtube.com/patient modesty. Also, please watch our video, Surgery and Your Modesty. Let me share about some projects at Medical Patient Modesty. We have brochures about how medical professionals can be more sensitive to patient modesty that we want to distribute to as many medical professionals, nursing school students, and medical school students in America as possible. We have brochures about how men can stand up for their rights to modesty. This is a serious issue because many men care about their modesty in medical settings. Sadly, most urologists do not even employ one male assistant or nurse to assist with male patients. I encourage you all to check out the Male Patient Modesty article on our website to understand the challenges male patients face. We desire to distribute as many brochures to men in different communities. We also have booklets about how women can protect themselves in medical settings that we want to distribute to as many women, especially college-aged women, across America. This is a very important issue because sexual abuse by medical professionals is common, and you rarely hear about how women can prevent sexual abuse by medical professionals. Look at the list of doctors and other medical professionals according to news that have sexually abused women by going to this website at www.sexualmisconductbydoctors.com. This is only a short list because most medical professionals can get away with abuse without being held accountable. Doctors have a lot of power in our society, and it is easy for them to get away with sexual abuse under the guise of medical care. It should not come as a surprise that male doctors or male nurses, especially male gynecologists who do intimate procedures on women, are at the top for abusing women. Take note of that fact that many of the male doctors who have abused women were very well liked in their communities and practiced for at least 20 years. For example, look at the gynecologists Dr. Paul Becton and Dr. Nikita Levy were very well liked in their communities who secretly took pictures of women's private parts during gynecological procedures. Our booklet discusses the truth about how chaperones, such as nurses and assistants, often do not help to prevent abuse by male doctors. In fact, chaperones are often there to protect the doctor by using excuses such as, "Well, he was thorough." I encourage you all to take the time to watch the video, History of Gynecology and How to Prevent Sexual Abuse in Medical Settings, on YouTube. This video exposes the dark history of gynecology that most people do not know and important insights from a former male gynecologist, Dr. John Smith, who after 24 years of clinical education and practice came to the conclusion that men should not be gynecologists. He wrote the book Women and Doctors in 1992. He witnessed other male gynecologists abusing women under anesthesia. We need more funding to reach out to more people. I wanted to encourage you all to consider supporting Medical Patient Modesty financially and to volunteer by helping us to distribute those booklets and brochures. You can see the link to the GoFundMe fundraiser for the booklets for women on our home page. It is my desire to raise enough money before the end of this year so we can distribute at least 100,000 booklets to women. You can also go to the button at the top of the website that says Help to Support Us and click on the button that says Donate to Medical Patient Modesty. Your financial support would be greatly appreciated.